Hello and welcome to the Prime Reckoning. I'm Julie and this is a channel for women over 50. Today I wanted to talk a little bit about the vagus nerve and menopause.
So let's talk a little bit about exactly what the vagus nerve is. If you already know this information, you can skip forward past this photo and onto the article. The vagus nerve originates in your brainstem and extends downward through your neck and into your chest and abdomen. The nerve branches out to multiple organs, including your heart, lungs, liver, spleen, stomach, intestines, and kidneys. It is a critical component of your autonomic nervous system, ANS, which regulates involuntary physiologic processes like heart rate, blood pressure, and respiration. You're breaking it down a little bit further. Your ANS has two parts. The sympathetic nervous system, which owns the fight or flight response that prepares your body to respond to perceived threats, and the parasympathetic nervous system associated with the rest and digest response and helps your body return to a state of calm after a stressful event. So the vagus nerve and your physical health, it helps to regulate cardiovascular health, digestive health, and immune system regulation. And the vagus nerve and your mental health, it helps to regulate stress and anxiety, depression, and cognitive function.
So I found an interesting article about this. Let's go ahead and take a look. So this article is from Winona in their neurology and mental health section. It was written by Haley Keene and medically reviewed by Dr. Pranay. Oh goodness, I'm not going to be able to pronounce that. It was medically reviewed by a doctor. Okay. So let's dive in here. Hot flashes, heart palpitations, mood changes, and disrupted sleep affect millions of women in midlife. Over 3/4 of women report uncomfortable symptoms during menopause transition, and for many, these issues persist for years. While shifting hormone levels are a key driver, researchers are beginning to explore another contributor, the vagus nerve. The role of the vagus nerve in regulating the body's stress response and many other bodily functions has received increasing attention. As interest in alternative therapies grows, many are asking, could supporting vagus nerve function help ease common menopause symptoms? Although research on the vagus nerve and menopause is still developing, understanding this nerve's role in regulating essential body systems may offer new insight into symptom management. This article explores how hormonal changes may be linked to vagal tone, where symptom overlap exists, and how lifestyle strategies can support this powerful neural pathway. What science says about the vagus nerve and menopause. Research clearly supports the vagus nerve's role in several key bodily functions: mood regulation, inflammation control, cardiovascular health, and digestion. Several studies show that when estrogen levels drop, it can affect the body's automatic functions and lower vagus nerve activity. But there isn't much research yet that directly connects vagus nerve issues to specific menopause symptoms. Can't say that word today. Still, the idea makes sense. The vagus nerve affects many parts of the body that also change during menopause. Because of this, scientists are starting to look more closely at how supporting the vagus nerve might help with menopause symptoms. How menopausal changes might relate to vagal function. The hormonal influence. Estrogen helps support the part of the nervous system that manages automatic body functions like heart rate, blood pressure, digestion, and breathing. When estrogen levels drop during perimenopause and postmenopause, this balance can shift. The fight or flight response may become more active while the rest and digest system slows down. Studies show that lower estrogen levels may contribute to vagal tone impairment and increased inflammatory response in the body. The stress factor. Midlife can be a stressful time with career demands, caregiving roles, aging disappearance and shifting identity. Chronic stress raises levels of cortisol and adrenaline. These stress hormones can weaken the vagus nerve signals, making it harder for the body to calm down. When vagal tone is low, the stress response sticks around longer, making it harder for the body to relax. The inflammation link. Estrogen helps regulate inflammation by acting on multiple pathways. As estrogen declines, signs of inflammation often increase. The vagus nerve plays an anti-inflammatory role through the cholinergic and anti-inflammatory pathway, sending signals that slow down the immune response. If the vagus nerve isn't working as well, the body may find it more challenging to ease inflammation, which can lead to ongoing or worsening symptoms. Symptom overlap. Vagus nerve function and menopause meet. Note, while more research is needed to directly link vagus nerve dysfunction with menopausal symptoms, overlapping effects offer potential clues. Mood and anxiety. Low vagal tone is linked with increased anxiety and depression, both of which are common in perimenopause. Disrupted communication along the gut-brain axis and reduced parasympathetic activity may contribute to these conditions. Sleep disturbances. Vagus nerve activity supports the ability to wind down. Chronic stress and poor vagal tone may affect sleep quality, potentially worsening hormonal insomnia. Hot flashes. Some research suggests that the thermoregulatory instability or fluctuating body temperature during menopause may involve vagal dysfunction. Since the vagus nerve helps regulate cardiovascular function and blood pressure, it may influence how well the body reacts to temperature signals processed by the hypothalamus. Drops in vagal tone may amplify the body's heat response, contributing to hot flashes. However, this remains an emerging area of study. Digestive issues. The vagus nerve regulates digestion, including stomach acid production, motility, and gut-brain signaling. Individuals may experience bloating, constipation, or indigestion during menopause, symptoms that may be linked to lower vagal activity. Inflammatory symptoms. I'm telling y'all, I can't read that word today. Joint pain and other inflammatory complaints are common in postmenopause. Reduced vagal signaling could play a role in sustained inflammation. Heart health and palpitations. Estrogen affects heart function, and a decrease may contribute to feelings of skipped beats or palpitations. Changes in heart rate or blood pressure may also be a sign that the body's stress response is more active and the calming signals from the vagus nerves are weaker. The benefits of supporting the vagus nerve during menopause. Even without menopause-specific studies, strengthening vagal tone can offer general benefits that align with common midlife concerns. These include the following: lowering cortisol and adrenaline levels, improving emotional regulation and mood, supporting digestion and gut health, reducing inflammatory responses, and enhancing cardiovascular balance. Together, these benefits can improve resilience and quality of life, helping women navigate the menopause transition with greater stability. So, some practical strategies. Supporting vagal tone for potential menopause relief. While more research is needed on menopause-specific applications, the following practices are known to support vagal tone. Breathwork techniques. Slow, deep, diaphragmatic breathing stimulates vagal activity and promotes relaxation. Cold exposure. Brief exposure to cold water, such as a cold splash on the face, cold showers, or a cold plunge, may enhance vagal tone. They also help with those hot flashes. Sound and vibration. Humming, chanting, singing, and sighing can all stimulate vagal pathways through the vocal cords and the ear. Mindfulness and meditation. Regular mindfulness practice has been shown to improve vagus nerve function and reduce stress. Gentle movement and exercise. Activities like yoga, tai chi, and walking support parasympathetic activation. And I'll tell y'all now that yoga, I'm a trained yoga teacher, and it includes all the things above except for the cold exposure. So you've got your breathwork techniques, sound and vibration, mindfulness, meditation, all included in your yoga. So good stuff. Diet and gut health. A fiber-rich anti-inflammatory diet can support the gut microbe, which interacts closely with the vagus nerve. Social connection and laughter. Positive social interactions and laughter increase vagal activity and emotional resilience. These techniques are most effective when practiced consistently and tailored to individual needs. What works well for one person may be less effective for another. Finding the most helpful combination may take time and experimentation. Managing expectations and when to seek professional advice. While vagal toning techniques can be a helpful addition to a wellness plan, they are not a replacement for medical care. Women experiencing severe or persistent menopausal symptoms should speak with a healthcare provider about evidence-based treatments. HRT and vagal support combo for best relief. Hormone replacement therapy remains the most effective treatment for many menopause symptoms. For women who choose HRT or are good candidates, combining hormonal therapy with lifestyle strategies that support vagal tone may enhance both physical and emotional resilience. The vagus nerve as a supportive tool for the menopause journey. The vagus nerve is a powerful regulator of balance, healing, and recovery across multiple systems. While menopause presents complex challenges, understanding and supporting vagus nerve function may help reduce stress, improve sleep, support gut health, and enhance mood regulation. Vagal toning strategies, when paired with personalized medical care, may offer meaningful support for women navigating menopause. These accessible, low-risk practices can be part of a broader, evidence-informed approach to maintaining well-being through midlife and beyond. So, very interesting article. We do a lot of studying of the vagus nerve, like I said, when we do our yoga teacher training courses. So, definitely some interesting stuff here. And, as long as you're cleared by your doctor, incorporating some or all of these activities are probably a decent idea, even if they don't immediately help with your symptoms. So I want to move on to the product for today. And I want to talk about what I use for my hair, which is very frizzy today. Live in the South, and it's very hot and very humid. And I washed my hair yesterday, and I went outside, and that's never a good combination. I really try to wash it right before I go to bed so that it can dry before the humidity gets in there. I used a product to kind of try to help with that, and it didn't work very well. I don't know if I didn't use enough of it. This is the first time I've ever used that product. So I may use it a couple more times before I talk about it. But I do want to talk about the shampoo and the conditioner that I use. Several years ago, I stopped using liquid shampoo and switched to a bar shampoo. And I did a lot of research on different bars and kind of, which ones lathered, which ones felt better, because some of them have kind of a funky feel to them. And I settled on this one, and I've used it for a lot of years, and I really like it. So the product that I use, and again, I'll link this below, is the Ethique Beauty Bars. I use the solid shampoo bars and solid conditioner bars that they offer. They do offer a number of different types, kind of like shampoos do. They're for dry hair, for oily hair, thin hair, curly hair. They have different options. I purchased mine from Amazon. I suppose you can purchase directly from them. But I'll put links to all that as well as links to the articles below. But when I first started using these bars, I noticed a couple of things. The first thing that I noticed was my hair stopped falling out. I used to lose a massive amount of hair every time I washed my hair. Huge clump in the shower drain at the end of my shower. And with the Ethique I lose a couple strands of hair, but nothing like I was losing before. So that is a benefit. Also, I don't wash my hair very often with Ethique. I kind of wash it every couple of weeks whenever it needs it. As I get older and grumpier, I hate washing my hair, y'all. I can't stand the feeling of wet hair. I just hate it. I hate spending a lot of time in the shower. I used to love taking a nice long shower, and now I just hate it. I want to get in and out as quick as I can, and not having to wash my hair every day or every couple of days really helps out with that. And I also noticed that my hair really feels a lot cleaner when I use this. You do have to, it doesn't clean your scalp as well. So I bought a little scalp scrubber. And so when I put the dry shampoo on my hair, I go around with the scalp scrubber, and that helps to clean my scalp a little bit. But definitely highly recommend the Ethique shampoo and conditioner bars. They're good stuff. So I will link all that in the description box below. Please like and subscribe. It helps the channel. And you can also follow me on Facebook, where I'm more active, or on Instagram. I'm not very active on Instagram. I just don't understand it, y'all. But yeah, so all those links are below, and we'll see you in the next video. Bye, everybody.